All right, folks, this is Josh Nelson, VP of Sales with Healthy Habits Global. I want to welcome you to this call. You know, we're excited anytime that we have the privilege of having Mr. John Payne on this call. You guys know that we have a phenomenal product line called our HHG Fit line. And I'll tell you, folks, you know, this product line is what I'm most excited about with HHG. I mean, we're a very diversified company, which makes us unique in itself. But the HHG Fit line is a revolutionary product line in the nutritional industry. I mean, it's a product line that puts us 5 to 8 years ahead of what anybody else in this industry is doing. And all of us know that in business, timing is critical. And it's not just being in the right place at the right time, but it's having the right people that you're aligned with. And I will tell you that the relationship strategically that we've been able to build with Mr. John Payne is just a phenomenal blessing to this company. You know, this gentleman is a world-renowned key speaker at medical conventions. This gentleman travels all over the world. He is a walking book. I mean, a bunch of encyclopedia books. I mean, when it comes to nutrition and science and research and you know, just the human body and what we should be eating, I'll tell you, I have never met anybody in my life that is as knowledgeable as this gentleman. And all of these years and all of this money that he has invested into the research that he's done, he's developed a product line and chose HHG to be that delivery system to the masses. So I'm excited to have him on this call, and I'm going to go ahead at this point and just turn it over to Mr. John Payne.
Well, thank you, Josh, and I want to thank everybody for taking the time to spend a little bit of time to listen about something that I have a tremendous passion for. And I'll give you a quick background of how I got started down the path of nutrition and you know, healthy living and what was good for us and what was bad for us. I owned a medical company in Australia, and I sold out in late 1991. And shortly thereafter, my mother and two of my sisters were diagnosed with type 2 diabetes. Now, I grew up on a ranch in Colorado, and everybody I talked to told me that this was a lifestyle disease. And I couldn't quite come to grips with that because where I grew up, we raised virtually all our food. I mean, we were 55 miles from the nearest town that was a thriving metropolis of 1,300 people. So we had all the elements of not developing diabetes. Our food wasn't processed. We grew it all. We didn't use genetically modified seeds. We didn't use pesticides or insecticides or we grew everything in a natural way. It was organic before we even knew what the word was. And we certainly had plenty of exercise. It's just my dad called it work. So there was no justifiable reason for 3 of the 5 members of my family to all of a sudden develop type 2 diabetes. And the more I looked into it, the more I realized that, now we're talking back now, let's say 1992 on, I realized that, A, the medical community didn't really know much about it and weren't really seriously addressing it. My own physician, her exact words to me when I asked her about it was to tell my mother and my 2 sisters to not eat white bread, pasta, or white rice. That was the sole advice she could give me. So I did a lot of research, and I figured out really that this was very significant, that this was bigger than I thought. I met a PhD researcher, an outstanding world-recognized scientist at San Diego University who said basically, John, everything they're telling us is not accurate, that at this point in time, now think about this, we're talking about now in the mid-1990s, he said that roughly a third of all Americans were pre-diabetic or diabetic at that time. At that time, they were telling us there were only about 8 million. Well, I don't know, let's say there were around 300 million back at that point in time. Then he's saying that 100 million plus of us were pre-diabetic or diabetic. So I decided that I was going to devote my time and my resources to finding a solution for my family. Once I got really in depth, I had very good connections in Australia with the Minister of Health, and they directed me to some people at the CDC here in the United States. And in working with them and talking with them, they referred me to the World Health Organization in Geneva, Switzerland. Introduced me to two people over there, so I flew over thinking I'd spend a couple of days and learn a little bit about what direction to take, because nobody could really give me a direction that I could, in good conscience, believe or accept. And I ended up spending 3 months. And what they shared with me was a publication that they eventually published in 2001. And any of you can look any of this up online. I mean, it's all available. But they published a document on World Health called the WHO Technical Series Report 916. This is a 157-page, if I remember correctly, document that really changed my life. And that is, on page 42, this document states that we should all eat a diet that is compatible with the diet that our genes became programmed to respond to. Now, that really hit home with me, because what that said to me was that we had to eat a diet that was consistent with the diet that our ancestors ate. So we had to go back, 250,000 years, give or take a little bit, because science has mapped the entire human genome, and we know that as we are today, everybody on this call and everybody on Earth, our DNA is about 235 to 250,000 years old. So I redirected my research into only what food sources were available a couple of 100,000 years ago. And what I learned quickly was basically what our diet consisted of was a lot of vegetables, a lot of roots, a little bit of fruit, a tiny amount of meat, and really the only milk that we drank was our mother's nursing milk when we were first born. And I realized that since that was the case, I needed to go to where it was going to where we came from. And it's pretty well established that we originally emanated out of South Africa. So I went to South Africa, and I spent 2 years in the Transvaal Valley. And I want everybody to realize that's on this call is all of the formulas that are in Healthy Habits Fit program, they're all derived from the same fundamental research. And what we tried to identify is what was genetically compatible. And I spent 2 years there, and I researched what food sources would have been available 50, 60, 200,000 years ago. And one of the things that came out fairly quickly was there's about little over 400,000 recognized plant species. And of those, about 50,000 of them have medicinal properties. Now, some of those are beneficial and some of them are harmful. But of those 50,000 plant species that have medicinal properties, only about 2,500 of them are approximately 1 million years old. So they would be old enough to be genetically compatible to every human being on Earth. And it quickly became recognizable to me that plant-based whole foods are, quite frankly, the most powerful disease-modifying tools that are available to the human race. They're more powerful than any drug or surgery that's known to man. Well, at that point in time, after I had exhausted the research that I needed to do there, or felt that I could do in South Africa, the oldest continent on Earth is recognized as Australia. And because of my contacts in Australia, I went to Australia for a year. And what I researched there, I lived in an Aboriginal community out in the middle of nowhere in northern Queensland. And a very unique experience, I have to say. But I looked at what type of food products or food sources were available to them, what natural food sources. And then in sitting down to try to incorporate a formula, okay, that my mother and my sisters could and would take that would help them, I accumulated all of the research I'd done, plus I utilized all the contacts that I had made. And we have 93 independent scientific researchers that are affiliated with us worldwide. They're at major research institutions, School of Medicines, I mean, from Sweden to Japan to India to the United States to Argentina, Mexico. And what we do is we research, and we're kept up to date. I'm kept up to date on what the newest scientific discoveries are, what the newest clinical studies are showing, and we find out what is new, and it's part of what keeps Healthy Habits at the forefront. We find out 2 to 5 years before something new is published or written about. And all our formulas are based on, and we continuously enhance them also, but they're based on 3 basic health keys. And that is, all health is based, in my opinion, is based on 3 things: genetics, inflammation, and gut flora. And metabolic syndrome X is at the base of many of the most degenerative diseases we face. You know, type 2 diabetes, high blood pressure, high cholesterol, high triglycerides, fatty liver, a whole variety of ones that all fall under metabolic syndrome X. Well, they now are calling all forms of dementia and Alzheimer's type 3 diabetes. And our first formula was based on what fruits and vegetables, okay, were key to stimulate all of the mechanisms of actions that are necessary for cellular regeneration. Every day our cells regenerate themselves and replicate themselves several times. When we're young, they go very fast and do it many, many, many times. When you're old like me, it kind of crawls around the wheel a little slower. But our cells produce energy, regenerate, and replicate solely based on the nutrition that we feed them. Okay, and so the first formula that we developed was the Pure Essentials fruits and vegetables, and everybody knows that we need fruits and vegetables every day, and nobody eats enough of it. And because it's almost impossible to get a good, healthy number of servings of quality fruits and vegetables, and especially the vegetables. We need a small amount of fruits and a significant amount of vegetables. But it's almost impossible because the soil they're grown in and how they're grown and the type of hybrid and genetically modified seeds that the plants come from. You can't go to the grocery store and buy high quality. It's almost impossible to buy high quality foods that will generate all of the necessary mechanisms of action for cellular generation. And I'll give you one simple, quick example that everybody will readily recognize. Bananas. That banana that you eat is not the banana that our grandfathers and great-grandfathers and ancestors ate. It's picked while it's absolutely green, okay? And it gets yellow. It's shipped up here. It takes a long period of time to get here on a boat, just how they're shipped. And they turn yellow on the supermarket shelf or on your countertop in your kitchen. The second that banana is picked, no more nutrients go in it. So essentially what we eat is a whole lot of sugar, a lot of cellulose, and a little bit of potassium. But it does not have the full cycle and full circle of nutrients that a typical banana that existed 100 years ago had in it. Okay? So to validate what we're talking about with the Pure Essentials fruits and vegetables, we all recognize we need more than we eat. But here's some facts. University of Florida conducted a study using fruit and vegetable powders. That study showed that it repairs DNA. They just recently published last year in the United Kingdom and England an 8-year, 65,000-person study. This study showed that eating 7 servings of fruits and vegetables per day lowered our risk of dying from any cause by 42%. Okay? And the Pure Essentials fruits and vegetables, they provide the high-quality extracts. From the high-quality extracts, they provide the nutritional equivalent of 7.5 servings of key fruits and vegetables. the ones that are specifically necessary to stimulate all the mechanisms of action for cellular regeneration. Now, another formula that we developed, okay, is the Pure Life. Now, Pure Life is a combination of beta-glucans. It's very high quality, 70% pure beta-glucans, and you can buy from other people beta-glucans, but they will be low quality, no more than 20% pure. Healthy Habits Global's Pure Life are 70% beta-glucans. More importantly, they're very high potency, very high quality. They're beta-glucans 1, 3, and 1, 6, and they're extracted from the cell wall of yeast. There's no better way of doing it. And the very important thing that they do is they reduce inflammation. They dampen down inflammation, which is at the core of every degenerative health issue known to man. Okay? They also inhibit glycation. Glycation, you won't hear your doctor talk about that, but go on the internet and look it up. Glycation kills more people every single year than all the infectious diseases combined. Now, there's a very complicated description of what glycation is, but very simply put, it's when glycation occurs when an excess sugar molecule, which we all know we have too much of every day because there's sugar in almost everything. Okay, when an excess sugar molecule combines with an excess protein molecule. And in the New England Journal of Medicine, they published that 98% of all Americans, and this includes North Americans, Canadians, Hispanics from Mexico, etc., 98% of us consume too much protein on a daily basis. The average consumption is 102 grams. Now, a male needs approximately 56 grams, and a female needs approximately 46 grams of protein on a daily basis. Now, less than that is not healthy, but more than that is very unhealthy. Okay? So we always walking around, we have too much protein and too much sugar floating in our blood. So this glycation process combines in a nuclear explosion that throws off trillions of free radicals, and that's what damages our cells. And in the end, there's only one real disease, and that is when toxins cause some problem, okay, that causes a change in gene expression. That change in gene expression results in cellular damage, and cellular damage results in a degenerative disease. Okay? And the thing I want everybody to realize is this. The United States today ranks as number 42 in the world in life expectancy. We're right below Jordan and Malta. That's really not very impressive given the level of our scientific knowledge and medical system, et cetera. But we rank number 42 in the world. Okay? And we have to do something about it. You know, you and I, we can choose today what our future will be. Okay? We have the knowledge to act. And the problem is we all think we have time, but we don't have time. We have to act today to preserve tomorrow. Not only for ourselves. You know, I'm not afraid for me. I've lived my life. I'm old now, but I'm definitely afraid for my children and my grandchildren because they're our victims. My friend, realize this. Our children and our grandchildren, they're our victims. They eat what we provide for them. They eat what we promote to them. They eat what we advertise to them. They eat what they see us eat. It's up to us to do something about it. Now, genetic pollution and genetic tinkering endangers us all because Hippocrates said 2,500 years ago, let your food be your medicine and your medicine be your food. There is nothing genetically compatible, okay, in a genetically modified food, in a chemical. To give you an example, in a chemical. Everybody's seen the advertisements on TV where they advertise these drugs. They're going to do this thing for you, but they're going to do all these other things to you because there's no chemical that we we developed the genetic compatibility to 100,000 years ago or 10,000 years ago or 2,000 years ago. The founder, Sir William Osler, the founder of the Johns Hopkins Medical School, which everybody recognizes as a Tier 1 world-class medical facility. In 1934, he stated that the primary purpose of a physician is to educate the masses, not to take medicine. And like I said, everything I said, please look up on the internet. So everything we're eating out, I shouldn't say everything, but a big percentage of what we eat and what is available to us, if we're not careful, okay, is genetically modified or it's a hybrid. You know, they've got in the seed themselves that the plant comes from, they've got an insecticide or a pesticide or both in them. Okay, well, if they'll kill weeds and bugs, what do you think they do inside of our gut? Recognizing what I said earlier, that the three keys to health are genetics, inflammation, and gut flora. There's only two things that gets absorbed in our gut, and I'll get to Pure Complete, which is a keystone to everything we do. But whenever we ingest something, okay, whether it's a liquid or solid, if the enzymes and the bacteria in our gut recognize the shape of the molecule, it gets cleaved into nutrition, absorbed, and utilized as nutrition systemically throughout entire cell structure. If they don't recognize the shape of the molecule, the body's desperate to survive. So it cleaves out the sugars and the simple carbohydrates, which are quick energy sources, and that's what it survives on. But our body, our systems developed to burn fat for energy, not sugar and simple carbohydrates. So we have to inhibit the body's ability to absorb a sugar molecule, okay? Because there's only two things in the world that we ingest that gets absorbed in our stomach lining before it gets to our gut, and that's sugar and alcohol. And the liver converts the alcohol to sugar anyway. Okay, so we have to inhibit the body's ability to absorb the sugar molecule. In Pure Complete, we've developed a product that is it inhibits the body's ability to absorb a sugar molecule. It also dampens down inflammation, and it helps repopulate, okay, and correct the balance of specific important populations of gut bacteria. Everybody on this call knows somebody or multiple somebodies that can eat anything and everything they want and they never gain a pound. Well, I can tell you why. You know, me, I walk by the dessert counter, I just think about it, and I added 5 pounds by the next morning. But here's why. There are two specific gut bacteria populations that are very important to our health. And that is Bacteroidetes and Firmicutes. And we're supposed to have ratios of 1-to-1 in our gut. The average North American has between 1-in-20 and 1-in-80. And if you have too many Firmicutes in your gut, you'll absorb 40% or more calories from the same amount of food, the identical type of food, same everything, identical food and quantity as somebody who has a proper 1-to-1 balance. So you're eating the same thing, but you're absorbing 40% or more calories from that food. That's why we gain weight, and the person who has the proper balance of 1-to-1 or something close to that, they can eat whatever they want and they don't gain weight. Okay, it's very important that we look at prebiotics and probiotics, and Pure Complete meets that. It dampens down inflammation. It meets the plant-based. It's an all-natural plant-based formula that meets the genetic compatibility standard that's required by Healthy Habits, and it rebalances the population ratios and repopulates the gut of the proper types of flora. So it's very important that we understand that what we do and how we do it and what we eat is really what will determine what our health is. And everybody thinks that the mentality that's developed over the last 50 years is, well, take a pill first thing in the morning and everything will be all right. That is absolutely not true. New scientific studies have shown that metabolic syndrome and all of the related health issues are growing exponentially worldwide. And in 2003, Dr. Alan Roses, who's the worldwide VP of genetics at pharmaceutical giant, one of the top three, GlaxoSmithKline, he confessed in a published interview that the vast majority of drugs, more than 90%, only work in 30% of the people. Okay? And the Healthy Habits Fit product line, they're proven viable options for safe, wide-spectrum health support, okay, for all humans. And it simply put, what Pure Complete allows us to do, it's been proven to inhibit the absorption of sugar, limit glycation, it promotes healthy blood glucose levels, it enhances and improves insulin sensitivity, it promotes healthy weight loss, and it positively affects the triad of gut destruction and immunogenicity of foods. Now, one of the very important things that it does is it promotes the regeneration of mitochondria. Mitochondria is it's the energy plant in every cell in our body. And what it does is it promotes mitochondrial proliferation, cell membrane stabilization, cellular energy, and mitochondrial efficiency. And worn out mitochondria, which happens as we age, contributes to our aging, okay? And it contributes, virtually every degenerative disease can be tied back to inflammation and mitochondrial inefficiencies, okay? It also has been proven to reduce lipid peroxidation. It elevates glutathione content in the body, okay? And it triggers your aging brain cells to grow new mitochondria. There are numerous studies that have indicated that one of the key ingredients in there, PQQ, supports brain, cognitive, and nerve health. It promotes healthy cardiac and cancer protection, mitochondrial biogeneration or biogenesis or the birth of new mitochondria, energy production, and stress tolerance. Those are all very keys. And now PQ has been identified as a powerful antioxidant, okay? And it's really being considered now by most people in the scientific arena as an essential nutrient. And, there's absolute proven science now that new mitochondria can be generated using this new molecule PQQ, which is in Pure Complete. There's a major difference, just like there are in different foods. Our plants are grown in the glacial strip of northern United States and southern Canada because that is the most nutrient-dense soil left on Earth. I mean, it's not depleted. We don't have to artificially put the nutrients back, such as nitrogen, into the soil. So that's where we grow the plants that are the natural plants that are in all of the Healthy Habits Fit products. There's one other thing that's very important in talking about PQQ. That's just one example. As we age, our body no longer absorbs nutrients like it did before. And this is very important and why you have to take these formulas. And it's optimum if you do it twice a day. Here's why. Our body uses or eliminates all of the vitamins and minerals every 12 to 16 hours, depending on how fast the metabolism is. The younger, the faster, the older, the slower. So we have to continuously replace those to maintain a healthy cell structure. Okay? Now, what we put in all of the formulas with Healthy Habits Global, all of them, Pure Complete, Pure Life, Pure Essentials Fruits and Vegetables, because we no longer absorb the nutrients at a decent rate. And PQQ, it's more difficult to penetrate the cell membrane of the mitochondria than it is the blood-brain barrier. You could take all you want of it, and you won't absorb it. In every formula, we have a minimum of 2 delivery ingredients. And because people absorb at different levels in different ways, as we age, younger people absorb one way, older people absorb a different way. We have at least 1 or more delivery ingredients in every formula to promote the absorption, young or old, okay, or young or middle-aged. So you actually are able to absorb and utilize all the products. And there's another example I'd like to. PQQ is a very key and important ingredient that we use because, you know, regenerating the mitochondria is just, it's critical to anti-aging, and it's critical to health, and it's critical to you know, pulling yourself back from a dramatic health problem. And that is, you can buy a PQQ, synthetic PQQ, okay? It costs about $700 a kilo. You don't absorb it anyway because it's synthetic, and no synthetic is genetically compatible. The bacteria and the enzymes in your gut don't recognize the shape of the molecule. The PQQ that we use in Pure Complete only comes from one source. There's one patented source that's all natural, and depending on the time of the year and what the harvest is like, it costs us between $10,000 and $80,000 a kilo. Now, you only need a nano amount of it, but you need it every single day. And it's all natural, and it's the only known source. But because it's so expensive, that people just won't use it in a formula. And one of the reasons that I chose to go with Healthy Habits Global is in my meetings, because I turned down several direct marketing or multi-level marketing companies before I decided to work with Healthy Habits Global. And in a meeting with Ted and Kevin and Josh at Healthy Habits Global, which really I think they had this meeting as just a courtesy to one of their friend and mutual friend of mine, Paul Chevery, and I actually met with them thinking the same thing, that I'm going to be in California anyway, while I'll meet with them. Within an hour, we had agreed to work together. Their philosophy met directly with my philosophy, and that is we provide the right stuff. It does what we say it does, and it is genetically compatible to every human being, regardless of ethnic background or geographical background. And the agreement was that we would provide that regardless of the cost. We would shortchange ourselves before we would shortchange our clients. Because quite frankly, my friends, with all the years, and all the research I've done, and I've spent now 25 years researching this, and what I discovered was, I did it for my own family, but what I discovered was so important that I couldn't in good conscience not try to share it with everybody, because it's not being talked about out there. It's now, people are now starting to recognize that we need to eat natural products. But it's very important that we recognize that we need to eat what our own DNA, our own genetics have been programmed to respond to. There's a very controversial study that was done at Michigan State University back in 2001 also. Everybody attacked this guy, ended up pulling everything back, but it was very accurate and quite a simple study when you look at it. And it showed that it takes the average, I said that wrong, it takes a human cell approximately 31,500 generations to adapt to a single new food source. Now that's about 630,000 years. If our DNA is only approximately 250,000 years old, then there's nothing that's processed, there's nothing that's genetically modified, there's nothing that has a chemical in it, there's nothing that has a hybrid that will truly be recognized in our gut by the enzymes and the bacteria there. They're not genetically compatible. Now, I recognize that people really aren't going to change. About 2% of the people will change, 98% won't. So I had to develop formulas that would mitigate what we're going to do to ourselves anyway. And that's why we inhibit the absorption of the sugar molecule. sugar is probably the greatest toxin known to man. It's in everything. So the Healthy Habits agreement that we made was that we would provide products that no other company has, okay, that would be as effective as we could possibly make them. And, you know, we've made sure that not just today, what we have scientifically today, we're always going to stay ahead of the cutting edge of genetic nutrition, because me and my team of doctors and scientists, we're continuing to do our research behind the scenes at all times. And Healthy Habits has the most innovative formulas out there now, and they will continue to get new innovative products that will keep Healthy Habits global ahead of the rest of the nutritional world. And that is a tremendous advantage. And I want to say, this has never been done before. I mean, everybody looks at the marketing story and what claims you make. There are more than 155 clinical studies to validate Pure Complete. Fruits and vegetables, I just quoted two of the most significant ones, the University of Florida and the University of, the English study, the UK study, okay, and the Pure Complete, the beta-glucan product, okay, you can go on PubMed. There are over 1,600 independent clinical studies validating everything I've just stated and more, and recognize that it's the purest form that I know of that's available in the world. Lastly, why would you want to take the Healthy Habits Fit products, the Pure products? Because Pure has the most powerful health-building components incorporated into their formulas available in the world. And they all specifically bridge the discordance between our ancient genetically determined biology and your nutritional needs of today. Every ingredient has a purpose and a value, and all of the ingredients have been extensively studied and proven. And all the Pure formulas focus on nutrigenomic activity. That's the nutrient-gene interactions, okay? And the nutrition that you take must match your inherited DNA to be effective, and the Pure formulas provide the necessary matched resources for health as well as healthy weight loss. Okay, Pure they're optimally balanced so that each ingredient enhances the other ingredients. You can put in a formula a lot of ingredients, okay? But two good ingredients, when they're matched together, they can form a third ingredient, which is not good, but is entirely, it could either be harmful or they could negate each other, okay? In all the Pure formulas, they're optimally balanced, so each ingredient is synergistic with all the other ingredients, and each ingredient enhances the benefits of each ingredient. And this type of balanced nutraceutical nutrition's never been done before. Josh, I'll turn it back to you.
Awesome, John. If you could just take a second, I just want to let everybody know, you provided us with like 9 volumes of documents on all of these products. And, we're letting everybody know today that they are now up at HHG University under the product training tab. You can go down under the HHG Fit line. There's 9 volumes of documentation for our distributors to use that have been approved and assembled by John and his team. If you could just take a minute, John, and just kind of share with people how powerful those are and kind of what type of content is in there and what they would use those for. Because I know, I've been in the industry about 15 years, and I know you've been approached by a lot of different companies. You've seen just about every product out there. And I've never seen the type of credibility and content that you've put together for this product line. I mean, I think people would be crazy, to see this information and not get excited about taking the product. So if you could just kind of share with everybody real quick what those documents are, because they're now available for everybody to use.
Okay, thanks, Josh. Yeah, simply put, before we bring a product to market, we go through a specialty FDA, FTC law firm in Washington, D.C. by the name of Swanken and Turner. And we submit all our documentation to them on what claims we want to make about each product. And in that documentation, we provide all of the clinical studies, and we provide access to all of our scientific researchers that are involved in the formulation of the ingredient profile, but also in the formulation of what we call substantiation and validation of each formula. And then what they do is they have their experts go through all of our documentation and validate it, verify it, and then they interview our key researchers to have a secondarily establish the validity of what we've claimed in our documentation. And then what they do is they provide us with a document that says we meet and exceed all of the regulatory requirements to make those claims. And like I said, with Pure Complete, there's more than 155 independent clinical studies to validate the formula and what we claim the formula does. The Pure Complete, there are over 1,600 independent clinical trials that you can go on beta-glucans and pure high-potent beta-glucans. On PubMed, you can validate. In fact, there's a lot of things that we could say that we don't and what they do, and you'll find that on those studies. So we've got more than 155 on Pure Complete. We've got over 1,600 on Pure Life. There's many on the fruits and vegetables. I think everybody recognizes that they need to take more high-quality fruits and vegetables than they do on a daily basis, and this provides them that 7.5 servings that's required or is recommended. And the important thing is that if you look at what the government, shall we say, publishes as what you need, they change it every couple of years, and because the nutritional quality and the nutritional density of the food sources that are available to us out there, they've gone from 5 servings to 7 servings, and now they're at 9 servings. It's because you don't get out of the food you eat what you need, and that's what the Pure Essentials fruits and vegetables do. There's 2 key studies, which to me answers everything that I think is really important, and that is it repairs our DNA, which is the source of virtually every health issue in the end. And then it reduces, if we take 7 or more servings a day, and Pure Essentials is the nutritional equivalent of 7.5 servings, it reduces the chances of us dying from any cause by 42%. I mean, I don't know anybody that's validated their formulas at that level independently. Every one of those are independent clinical studies.
So basically what you're saying, John, is because basically what you're saying is, because I know in the nutritional industry, we've had a chance to look at a lot of companies, and they really, really stay away from making really any type of claims that I've seen in these documents, which I really challenge everybody to get into the HHG University night and download them. So what you're saying is that those documents were created so that whatever content is in there are actual claims that we can make and validate on these products.
Well, the ones that we state that we can make, yes. There are many more claims that show on the studies that we would be able to make that we don't make, just simply because there's just too much. And if you go into certain areas, you're always going to
we all know how the FDA
be challenged. Yeah, exactly. So we make the ones that are FDA and FTC specialists, lawyers say we have validated and substantiated. And I ought to state one more thing. In the document that we got from Swanken and Turner, it specifically stated that not only did we meet and exceed for these formulas, not only did we meet and exceed all the regulatory requirements to be able to make our claims, but that they had never seen this level of substantiation before.
Wow, that's incredible. Well, I just want to thank you for taking the time, John, and getting on the call tonight. Guys, we're going to wrap this call up. I just want to let you know that, when you listen to Mr. Payne speak about these products, I haven't seen any product in the industry in 15 years that has this much due diligence and passion that has gone into the development of a product line like this. I mean, we all know most companies, they go out and they borrow a bunch of money and they go, quickly formulate and take a product to market, and they just throw some ingredients in there that, that people say do this or that. But John has actually taken the time, hiring a staff of over 90 researchers and doctors and scientists to develop these products and to make sure that the ingredients are synergistically working together, they're being delivered properly into the system, and that the customer, the end user, is actually going to get the benefit that we're claiming. And we've all seen that. I mean, we've got testimonials that to this day absolutely blow my mind. So we are really in a position as a company to do big things with this. I mean, we look at the nutritional industry in the direct sales environment, and there's companies that have generated hundreds of millions, if not billions of dollars on products that were just thrown together. I mean, can you imagine what we can all do, for humanity? And the byproduct of that is what's going to happen financially for all of our families. So again, John, I just want to thank you for everything that you've done and the 25 plus years and the millions of dollars that you've invested and for choosing to align with us. It's a blessing to have you here. And folks, we are going to be doing an opportunity call tomorrow at 7 p.m. Eastern time. We'll put an email out tonight as a reminder. It'll be the same number, same time as we do on Tuesday. We're doing these calls every Tuesday and Thursday now. So you guys have an opportunity to invite people onto this call tomorrow so that they can learn how to position themselves with Healthy Habits Global. So we're going to go ahead and end this call. And again, John, I want to thank you on behalf of the whole company for providing these products to us. I mean, it's changed my life. I haven't been sick in 10 months. I've lost 20 pounds. I mean, the product is phenomenal, and I've seen that, amazing things happen to family members that I have on the product as well. And I have definitely developed the passion that you have for this product line as well, and we want to get it out to the masses. So thank you again, and thank you everybody for getting on the call. This call was recorded. We will have it up for you guys in the university. So if your team wasn't on the call, you can send them into the university, get them on, go download those documents, go through them, and let's all go out and make a bunch of money, and let's change a bunch of lives. Thank you guys for joining us. God bless. Have a wonderful evening. This call is officially over.